Laryngitis. Laryngitis is an inflammation of your voice box, which is called the larynx. This inflammation can arise from overuse, irritation, or infection. Normally your vocal cords, part of the larynx, open and close smoothly, forming sounds through their movement and vibration. But with laryngitis, your vocal cords become inflamed or irritated. Symptoms. In most cases, laryngitis symptoms last less than a couple of weeks and are caused by something minor, such as a virus. Less often, laryngitis symptoms are caused by something more serious or long-lasting. Laryngitis signs and symptoms can include hoarseness, weak voice or voice loss, tickling sensation and rawness in your throat, sore throat, dry throat, and dry cough. The vocal cords are two folds of mucous membrane covering muscle and cartilage. When the vocal cords become swollen, they can distort the sounds produced by air passing over them. As a result, your voice sounds hoarse. In some cases of laryngitis, your voice can become almost undetectable. Laryngitis may be short-lived, called acute, or long-lasting, called chronic. Most cases of laryngitis are triggered by a temporary viral infection and are not serious. Persistent hoarseness can sometimes signal a more serious underlying medical condition. When to see a doctor. You can manage most acute cases of laryngitis with self-care steps such as resting your voice and drinking plenty of fluids. Strenuous use of your voice during an episode of acute laryngitis can damage your vocal cords. Make an appointment with a doctor if your laryngitis symptoms last more than 2 weeks. Seek immediate medical attention if you have trouble breathing, cough up blood, have a fever that will not go away, and have increasing pain over weeks. Seek immediate medical attention if your child makes noisy high-pitched breathing sounds when inhaling, called stridor, drools more than usual, has trouble swallowing, has difficulty breathing, and has a fever. These signs and symptoms may indicate croup, an inflammation of the larynx and the airway just beneath it. Although croup can usually be treated at home, severe symptoms require medical attention. These symptoms can also indicate epiglottitis. This is an inflammation of the epiglottis tissue, which acts as a lid to cover the windpipe or trachea. This inflammation can be life-threatening for children and adults. Causes of acute laryngitis. Most cases of laryngitis are temporary and improve after the underlying cause gets better. Causes of acute laryngitis include viral infections similar to those that cause a cold, vocal strain caused by yelling or overusing your voice, and bacterial infections, although these are less common. Causes of chronic laryngitis. Laryngitis that lasts longer than 3 weeks is known as chronic laryngitis. This type of laryngitis is generally caused by exposure to irritants over time. Chronic laryngitis can cause vocal cord strain and injuries or growths on the vocal cords, such as polyps or nodules. Chronic laryngitis can be caused by inhaled irritants, such as chemical fumes, allergens, or smoke. Acid reflux, also called gastroesophageal reflux disease, GERD. Chronic sinusitis. Excessive alcohol use. Habitual overuse of your voice, such as in singers or cheerleaders. And smoking. Less common causes of chronic laryngitis include bacterial or fungal infections, infections with certain parasites, cancer. Other causes of chronic hoarseness include vocal cord paralysis, which can result from nerve injury due to surgery or injury to the chest or neck, cancer, nerve disorders, or other health conditions, and bowing of the vocal cords. Risk factors. Risk factors for laryngitis include having a respiratory infection, such as a cold, bronchitis, or sinusitis. Exposure to irritating substances, such as cigarette smoke, excessive alcohol intake, stomach acid, or workplace chemicals. And overusing your voice, by speaking too much, speaking too loudly, shouting, or singing. Complications. In some cases of laryngitis caused by infection, the infection may spread to other parts of the respiratory tract. Prevention. To prevent dryness or irritation to your vocal cords. Avoid smoking and stay away from secondhand smoke. Smoke dries your throat. It can also cause your vocal cords to become irritated. Limit alcohol and caffeine. These cause you to lose total body water. Drink plenty of water. Fluids help keep the mucus in your throat thin and easy to clear. Keep spicy foods out of your diet. Spicy foods can cause stomach acid to go into the throat or esophagus. This can lead to heartburn or gastroesophageal reflux disease, GERD. Include a variety of healthy foods in your diet. Eat fruits, vegetables, and whole grains. These have several vitamins, such as vitamins A, E, and C, that are important for overall health. These foods can also help keep the mucous membranes in the throat healthy. Avoid clearing your throat. This does more harm than good because it causes an abnormal vibration of your vocal cords and can increase swelling. Clearing your throat also causes your throat to secrete more mucus and feel more irritated, making you want to clear your throat again. And avoid upper respiratory infections. Wash your hands often and avoid contact with people who have upper respiratory infections such as colds. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.